What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, October 24th, 2023. We're going to start off with 4 things from Twitter, otherwise known as X. I will always call Twitter. 2 of them are not things that I posted to Twitter. Then the other 2 are things I did post to Twitter. And the first one is a news item. Jimmy Kimmel had COVID just a few weeks ago. Well, COVID is continuing to hit the show pretty hard. 3 of the show's band members from Cleto and the Cletones have COVID now. And he actually, in a way, kind of made a joke about it, which, yeah, I like to watch Jimmy Kimmel, but I don't think this is something you should be joking about. Not a great night to be in a crowd. We're getting hit pretty hard with COVID, Kimmel tells his unmasked audience, and I actually watched the video. I can't show you this video because it's a YouTube video. I believe that's a YouTube copyright. I don't want to get any copyright issues, but he then goes on to say, make a joke about Paxlovid. Yeah, I mean, if you catch COVID, it's serious business. He's had it a couple times, and yet he made a joke about it. Whatever. Moving on now. You may have heard me mention the other day JN.1. Well, apparently, we're now learning 2 things about JN.1. Number 1, it's rising in France, more so France, and also in the UK, a little bit of JN.1 is showing up. JN.1, what I'm starting to find out is a grandchild descendants, like an offshoot lineage of BA2.86. And apparently it's an actual lineage of BA2.86 1.1. Yeah, it's like a tongue twister, if you can understand that. But it's nothing to be too alarmed about right now, but it is something, he says here, JN.1 got wings in France, and if the scientists, virologists, people that study this, with degrees and whatnot, are concerned about it or are watching it, well then obviously it's something we have to keep an eye on as well. Alright, moving on. On my way home today, I stopped at CVS to pick up 2 prescription orders that were sent in for me last week from the doctor's appointment I went to last week. I had to pick up a nasal spray and that EpiPen that I'm going to eventually learn how to use in case of severe coughing fits or breathing emergencies. Well, I get up to the counter, nobody in line, which was very surprising for my CVS. And you may think, wow, nobody in line, but look at this picture. Look at all these prescriptions that were sitting there waiting to be picked up at my CVS. I have been going to this CVS for decades. Back when I was a caregiver, my grandmother's prescriptions were there. We picked it up there. My parents' prescriptions are there. You get the idea. And we've been going to CVS since I've been a kid. It used to be in another location. Then they built a standalone location. It never used to be like this. And to make things more interesting, that's not all the prescriptions. She said, I'll be right back. I'm going, oh, wait a second. The prescription's right here. Oh, no. They had to go around the back and behind, and apparently my prescriptions were on more racks that are behind us. Now, there's 2 potential reasons as to why it's gotten more insane in CVS and, quite frankly, all drugstores. I used to work in Rite Aid. About 8 years ago, I was still at Rite Aid. I was a front-end shift manager, but I would help out the pharmacy sometimes, and trust me, we never had that many prescriptions. So here's 2 potential reasons. Number 1, anyone who gets COVID can potentially develop long COVID or new issues afterwards. Maybe they're positive for COVID. Maybe they need Paxlovid. Maybe they have a new heart problem. Maybe they have a new memory issue. Maybe someone has developed diabetes. Blood clots, all these different things that could pop up that could potentially need you to get a prescription. Inhalers. There's a lot of people post-COVID with lung issues that now need inhalers. So, all these reasons could be, all these different things could lead to why there are prescriptions sitting there. But there's also another big reason. And maybe you have guessed what I'm coming to. Prescriptions, healthcare in general, are very expensive in the United States. It is ridiculous. How many times have you gone up in a pharmacy, you're starting a brand new prescription, you get up to the register, you don't know what it's going to cost, and then you see it say, Oh, this is going to be $150. Never mind. I can't afford that right now. I'm gonna have to pass on getting this, and maybe I can try and get a prescription plan or one of those drug carriers that help make it more affordable. There's assistance out there, so maybe they try and get that. Well, that's another reason why you can see a lot of prescriptions sitting there because healthcare prices have skyrocketed, and some of these new prescriptions that you're now starting because you've had COVID are really, really expensive. I know for me, I picked up just two prescriptions, and it came to just a nasal spray and the EpiPen. It came to $40. I mean, and that's nothing. Some people pay way more. Back when my grandfather, God bless him, years ago, had cancer, there was a prescription. It was over $1,000 every time he had to get it. It was ridiculous. Eventually, somehow, we got him onto our program where it paid for it. But yeah, prescriptions are really expensive. Healthcare is really expensive. It leads me to this poll that I just posted. Let's refresh this. And I put just a simple poll question. Do you think healthcare in the U.S. is too expensive? Well, since 4:56 p.m., we're 84 votes in. We're going to revisit this again tomorrow. 100% of the votes say yes. If you follow me on Twitter, at COVID Data Report, by all means, please vote on this. I want to know your opinion. And if you're paying way too much for healthcare, let us know down below. We want to know about it. And something needs to be done. We need Bernie Sanders or someone to come in and make healthcare more affordable in this country. I mean, it's just ridiculous. And I'm going to be honest with you. That doctor's appointment I went to last week, it was a specialist. I had to pay $150 out of pocket just to see a darn specialist. That should not be the case in this country. I mean, it is just totally ridiculous. Let us know down below if you're paying too much. You don't have to share what you're paying for a month. That's your business, not ours. But if you're paying too much, just, hey, say so. Let's move on to the data portion of today's update. And you can see air quality. It's not perfect today, but there is also green. We're continuing to see some orange and red and yellow on the west coast. And there was also some smoky conditions yesterday and fog down in Louisiana close to New Orleans. You're still seeing some yellow here, which those conditions, it actually led to a major accident on Interstate, I believe it was Interstate 55 in New Orleans. Multiple people dead. Well over 100 cars piled up between the smoke and the fog, which led to that. Not good. You're also seeing some yellow today in the Great Lakes region. That's not good. And I think we're going to see that shift into the east. I think the east is going to go into some poor air qualities heading into the weekend because there's going to be a big, unusual warm-up. Yes, that goes with climate change. I promise, eventually I will get back to my climate channel. It's just crazy times right now. Moving on to heat-related illnesses, we were going to stop this for the season. We're going to continue this probably at least into the first week of November. And the reason being for that is, like I just said, there's another warm-up that's coming in the east. I mean, we could see heat-related illness calls increase again on places like along the I-95 corridor. Last week, there was a jazz festival, which led to some heat-related illnesses out in the southwest U.S. And in general, look at this. There's a lot of counties that are seeing higher than average calls for heat-related illnesses. All right, let's move over to Walgreens now. We didn't do all the states yesterday. There's a few more states that we can do. We may repeat ones that we did yesterday. We're just going to do a few more states. Not many, just a few. Nationally this week, 26.4% positivity. The prior week was 25.8%. That's a difference of up 0.7%. Total test, 11,616. The prior week was 11,593. So that is slightly up. I know for a fact we did not do Maryland yesterday. What's going on in Maryland? 22.7% positivity. The prior week was 15.8%. Difference of up 6.9%. Total test 22 versus 38. Testing did drop, so yeah, part of that is because of testing. Virginia this week, 24.1% positivity. Prior week was 22.9%. That's up 1.2%. Total test 340. Prior week was 323. North Carolina this week, 21.3% positivity. The prior week was 26.5%. Difference of down 5.2%. Total test, 596 versus 638. Yep, Testing is down, but hey, the positivity still drops, so that makes for a legitimate drop. How about Tennessee? Tennessee this week, 23.4%. The prior week was 26.1%. There was a down 2.7%. Total test, 342 versus 314. Louisiana this week is up a little bit, 18.7% versus 17.3%, up 1.4%. Total tests, 107 versus 104. Texas this week. This is a state where we do see more testing done. 22.8% positivity this week, 23.8% last week. That's slightly down 1%, and testing is slightly up. 1,866 versus 1,828 tests. How about Nebraska? Nebraska, 34.8% positivity this week. The prior week was 27.7%. Difference of up 7.2% total test. 66 versus 65. Let's go over to New Mexico. New Mexico this week, 36.2% positivity. The prior week was 34%. Difference of up 2.2%. Total tests, 174 versus 147. I wanted to show you the Dakotas. We can't show you the Dakotas because the Dakotas did not update. Wisconsin, 25.3% positivity this week. The prior week was 24.1%. That's a pretty big rise. 11.1%. Testing is just only down slightly. I think we're going to go with a legitimate rise here. 309 versus 323. Utah, 23.6% positivity this week, 27.1% last week. Difference of down 3.5%. Total test, 106 versus 96. And let's go over to Michigan, shall we? And this will be the last state we do. 29.4% in Michigan this week, 26.3% last week. That's a difference of up 3.1%. Total test, 296 versus 320. All right, moving on. I do want to take a look at a couple of wastewater scan sites today. Let's take a look at the national picture first. COVID has been dropping nationally since mid-September. Influenza, it did go up. Now it's dropping. We'll have to watch. It's just on the last update that it's dropping. That may correct, and we may find that it's rising. RSV is low at this time. HMPV is low. Mpox is low. Norovirus continues to be high. It is dropping ever so slightly on the most recent update, but we'll have to see if that gets corrected higher. Let's go and take a look at a couple of these wastewater sites. Let's take a look at Memphis. What is going on in Memphis, Tennessee? Well, COVID's dropping. Ruh-roh. Influenza at this time, while it's still low, looks like it's starting to be blast off and straight upward. Taking a look at RSV. RSV is low at this time. HMPV is low. No Mpox detected. And norovirus at this time is medium, but dropping. So it's good to see that norovirus is dropping. Let's go out to the West Coast and we'll do one site quickly on the East Coast. I say we do a site in California today. What is going on in San Jose, California? I'm curious. I'm pretty sure you're curious too. COVID, it's dropping. Influenza, it was rising, but now it's dropping. RSV is high, but on the most recent update, it has dropped. We'll have to see if that corrects higher. Look at this. San Jose, back on October 10th, did have the detection of an Mpox case. Ruh-roh, that is not good. Norovirus. Taking a look at norovirus here, you can see the overall trajectory for norovirus is rising. And now let's quickly do one East Coast site, and then we'll move on to some other data. Let's see, where do we want to go on the East Coast today? I say we should take a look down here, just south of the DC area. Let's go down here to Little Falls Run Wastewater Treatment Facility. If I'm not mistaken, this may be a new... No, it's not new. I was about to say, I don't recall ever checking this site before, so let's see. COVID, the overall trajectory, you know what? Since August, it's higher. The most recent update is lower. It's still low levels, though. Influenza is low. RSV is low. HMPV is low. Mpox, not detected. Norovirus is low and dropping. Wow, that's actually really low levels for norovirus, so that is good to see. Moving on to the CDC now. Here we go. In case you did not know, maybe you're new to my channel. If you are, subscribe down below. EG.5 is the leading COVID variant at 23.6%. Then comes HV.1, followed by FL151, And then we have XBB 116.6, which is at 10.3%, and then the rest are all below 10%, but there are quite a few variants out there. I mean, look at this. There's probably close to about 20 different variants now. Taking a look at hospital admissions, 16,158. New Jersey. Don't go by this hospitalization number. It says 131. Just a couple days ago, it said 500. I don't know why they updated all of their data. My only conclusion that I can think of is maybe they're not including people who test positive while in the hospital. Yeah, I honestly don't know. But for some reason, New Jersey did an update and they significantly dropped their number, all their numbers from the beginning of this tracking here. So I don't get what their deal is, why they did that. ICU number, there's still 20 people in the ICU, but I think that's significantly down now as well. So we can't really go by New Jersey's number. Taking a look at Philadelphia, there was an increased number of ambulance calls yesterday. 774 EMS calls. I repeat my same message from yesterday because, well, the Philadelphia Phillies lost last night, and we have to go to a Game 7. Should my Phillies win tonight, there will be an increased number of ambulance calls because there'll be big celebrations in the streets. And yes, unfortunately, that is going to lead to more COVID cases. Taking a brief look at the suburbs, yikes. Montgomery County is busy right now. 17 EMS calls. I'm seeing just about every type of call. Not seeing respiratory emergency, though. So I guess that's a good thing. Taking a look at what's going on in Chester County, Pennsylvania, and we can see here, there's just a few calls. I am seeing one that says respiratory difficulty and another that says stroke. Never good to see stroke on there. Now moving up the New Jersey Turnpike to New York State, where we have 971 new positive COVID tests. And we do have some bad news for you today. Yikes. Take a look at this. Yesterday's reported number, on yesterday's update, we reported that they had 1,254 hospitalizations. Today is much higher. 1,375. So that is a significant increase. I think, what is that? 121 higher? Someone correct me if I'm wrong. I think that's what that works out to. Let's also take a look at the admissions. Let's see if they went higher. Now, this is going to refresh on us, but here we go. Here's the admissions. The admissions, yes, they are higher than where they started the week last week, and that is never a good thing. We can see here that from last week's number, yes, it's starting off with a higher total from the weekend. That's not good to see. It could be a sign that perhaps maybe New York State is transitioning into the winter wave. A reminder, we're going to be looking at Hubbub World's data on tomorrow's pandemic update. And of course, we'll look at New York State and see what's going on there. We'll look at the what the prevalence is of COVID in several different states around the country. Let's take a look at Chicago real quickly. Yeah, Chicago probably has not updated yet, but it's good to remind you of what's going on there. And okay, does look like there is potentially an update here. I'm seeing the average daily hospitalizations is 12. Hospital beds in use is down by 1.4%. That's a good thing. Emergency room visits down 0.9%. Laboratory confirmed cases down. It's in the green. 88. Deaths 0.29. That's in the green. And taking a look at vaccines administered, that's in the red, down because, well, we want more people to go out and get the booster. And disclaimer, yes, data current as of October 18th. So that's not new data. Texas, we'll get an update on that tomorrow. I believe we'll also get an update on a few other states. Now let's briefly do a real quick international update. Russia, cases up 4%. Ooh, deaths now up 72%. 43 versus 25. New Zealand, cases now up 5%. 4,014 cases versus 3,815. Deaths up 20%, and that is 24 versus 20. Poland, cases now up 45%. Deaths up 300%. Coming down here to Chile, cases up 17%, no deaths reported. Belgium, cases are down 70%, no deaths reported. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update again tomorrow. Until I see you again next time, if you like this video, give it a thumbs up. If you want to see more content like this, subscribe down below, share this with your friends, and you know the deal. Stay safe. Continue to wear an N95 or better mask wherever you go because we are entering cold and flu and the 4th season of COVID. Yes, spring. Summer, fall, winter are all COVID seasons. I will see you again next time. Stay safe, everyone, and have a fantastic Tuesday evening, and thanks for watching.